My name is Jessica Whistler, and I am here to talk about the global health inequality, and I am in international relations class for 2025. I chose this topic because of reasons outside of my major that I hold close to my heart. I lived through a major health crisis and watched my mother go to work every day as a nurse. She has been helping people all of my life and is something that I look up to. While my political science major does play a role in solving the global health care inequalities, there is another reason I chose this topic. Over the next summer, I plan to help in the healthcare field with my mother at her job, and this would be the perfect opportunity to learn more about where my future will be. I am hoping to get insight on differences in the healthcare and how our lives are truly affected by it. What is global health inequality? It refers to the unjust differences in healthcare diseases and the difference in the access to affordable healthcare. Within the higher income countries, the United States is most affected because of its high cost in healthcare. This is because the people in the United States would rather skip medical care if they are lower income than get help because of the debt that medical bills can cause. The U.S. has the highest infant mortality rate and maternal mortality rate among the higher income countries. The lower income countries, the global impact of disease, illness, and other things are concentrated in countries that are Latin America and the Caribbean. They are seeking major disruptions in their healthcare, and they lack access within the regions. They have a lack of resources, a high patient-to-doctor ratio, basic issues from makeshift items, health challenges, and most low-income countries focus on public health. Poverty, discrimination, and limited access to healthcare is a very important issue, especially how many people in the world that it affects. Lower income countries have limited access to tools they would need to help medically, as well as the fact that there are not enough doctors for how many patients they have. Infant mortality rate, life expectancy, and maternal mortality rate are much higher in developing countries and countries that lack sufficient healthcare systems that can help all, not just the wealthy. These are just historical pandemics and outbreaks, like globally. In 1350, there was the Black Death. It was a major pandemic that changed Europe. In 1665, the Great Plague happened, which was mainly found in London, and the full name is the Great Plague of London. In 1918, the Spanish flu happened. It was a global influenza pandemic that is still around today. In 1981, the HIV/AIDS crisis happened, which was a global health crisis that still does not have a cure and affected a multitude of people. In 2003, the SARS outbreak happened, which was a viral respiratory illness. And in 2021, COVID-19 happened, which is the most recent pandemic first emerged. Factors contributing to inequalities. Socioeconomic factors. Countries with high poverty are likely to have reduced access to healthcare or at least good healthcare. Systematic issues. The absence of universal healthcare in countries and the financial burden of cares. Discrimination. In some countries, people are discriminated against and cannot get health care based off of their status or their race. These are just some pictures. So the top left is showing population with public and private healthcare coverage and percentages. The top middle, bottom left, and bottom right are just showing the kind of lack in space and doctors and medical equipment, and just showing lower income countries. The bottom middle is talking about quality health care and being accurately diagnosed. In some countries, only 35% of patients get the correct diagnosis. And then the top right is just a picture showing all of the world globally and showing how different countries are affected with healthcare. And then these are higher income countries. The two pictures on the left are medical equipment that most countries with higher income have. The two in the middle is showing what countries, what suppliers send the most devices, like what countries have, and the bottom middle is the countries with the most hospital beds. And then the top right shows how much space in comparison to these, and like this one, how there's multiple people in one room, multiple people in one room. The next one, there's just one person and 2 doctors in there. And this one's just about quality of healthcare. The main issues. Poverty, discrimination, and limited access to healthcare is a very important issue, especially how many people in the world that it affects. Lower income countries have limited access to tools that they would need to help medically, as well as the fact that there are not enough doctors for how many patients they have. Infant mortality rates, life expectancy, and maternal mortality rates are much higher in developing countries and countries that lack sufficient healthcare systems that can help all. The first solution would be investing in determinants of health, which would be addressing poverty and inequality, allowing people to get the education and employment they need in order to have access to medical care that they deserve. The second solution would be addressing and promoting equality in the health system. We would need to make sure that there is affordable health care for everyone in the world, not just for some. To piggyback off that, we need to make sure that all health care is fair for all, not just helping a few and dismissing others based off factors that cannot be controlled. Addressing the racial and gender inequality in the healthcare fields, creating more opportunity for everyone to get healthcare they deserve and the right healthcare. The third solution would be strengthening the healthcare system with global collaboration/partnerships. If we can improve access to different types of equipment needed in the healthcare and improvements to the workforce, then there would be a better system. The best way to improve the healthcare system would be collaborations. The countries that are developed and have a good system helping the poor countries develop their system. They can share information, resources, and different practices that they do to make healthcare the best. Thank you for listening.